My name is Dr. Ravichandran, a senior practicing dermatologist from Chennai. Today I am going to highlight the importance of a disease called psoriasis. We are observing the World Psoriasis Day this Sunday, and a few points take home message for this disease from a dermatologist perspective. This is to create an awareness about this chronic disease called psoriasis vulgaris, which is a scaly skin disorder. World over, it is very common to see this disease. 2% of the world population suffers from psoriasis. There are 125 million people suffering from this chronic ailment. Psoriasis is assuming a large proportion in India and affects the quality of life in patients being affected. Why people develop psoriasis? Why should they get proper consultation and advice? Because psoriasis have got an impact on the quality of life of these patients. All age patients develop psoriasis, and it affects, it's a lifestyle disease, because we have seen that psoriasis is a disorder of immune system wherein it is triggered by factors like smoking, obesity, alcoholism, sedentary lifestyles, and also associated with comorbid disorders like diabetes, coronary artery disease, arthritis, hyperlipidemia, high cholesterol level, and smoking and alcohol. So when you look into these factors, I think we need to address these other factors which triggers psoriasis. As I told you, psoriasis can start as a small scaly, like a dandruff on the scalp, can involve the whole surface of the body surface, where you have a fish like silvery white scales on the body parts, particularly elbows and knees and every part of the body. It can also affect the joints, can cripple the patient to develop a severe psoriatic arthritis. The disease has got remissions and exacerbation. Sometimes generally it gets triggered during the winter climates. A sore throat can trigger psoriasis. Children also can develop psoriasis following a streptococcal sore throat infections. So why this disease? As I told you, there are triggering factors, and probably we have to be very careful in identifying the factors so that prevention is better than cure. What are the classical types of psoriasis? We have the psoriasis called generalized plaque psoriasis, pustular psoriasis, erythrodermic psoriasis, scalp psoriasis, nail psoriasis, and psoriatic arthritis. How do you treat these patients? We have to treat these patients because this disease is not a contagious disease. Even in close contact, this disease does not spread to other family members, and then it disappears and comes back again, resolves, and then exacerbation and remission. So we have to, how do you treat this patient? How do you investigate this patient? It's a very easy diagnosis from our point of view. Most of the patients do this condition that, sir, can I have this disease? Is it like this disease? Yes, you have psoriasis. Most of the time the patients know themselves that this is a condition called psoriasis. They come to us for good help. We have to assess these patients depending upon their age, the type of psoriasis, the type of comorbidity, and we generally confirm the disease in quick successions. So how do you treat these patients? We have to treat these patients depending upon the type of psoriasis. A patient who have 10%, less than 10% of body surface involvement, we combine topical and systemic oral treatment. The topical agents, we give emollients, topical steroids, topical salicylic paste, and then we give oral therapy. The sheet anchor is systemic drug in the form of methotrexate, cyclosporin, phototherapy, and topical calcipotriol. So when patients do not respond to that, if the extension is very high, when their body surface involvement is more, we choose some other agents. The newer agents are in the limelight now, is called biologics. Biologic therapy is a very interesting and very effective therapy. We give small injections to these patients once a week, once in 2 weeks for a period of 3 to 5 months. So it gives a complete clearance. We talk about a PASI score reduction, psoriasis area severity index reduction, so that we achieve 75 to 100% PASI reductions can be achieved by biologics therapy. So we have to take care of these patients, educate them very nicely, spread an awareness, create an awareness, approach these patients from a different perspective, support them psychologically, support them in the environment, in the home environment, and because it can cause a lot of psychological depression, and then as I told you, they are not able to mingle with their relatives and friends in the office. So I think we have to give them big support so that they get treated properly, so that these kind of approaches are to be done. And awareness will create so that the patients do respond. As I told you, it's not a curable disease, but we can completely clear the scaly skin lesions to a great extent so that their quality of life improvement is there. And as I told you, it's now psoriasis is a new disease in this current millennium, that we have to be focused on this disease, help these individuals, and we have an effective options available depending upon the type and the disease, and we seek, this patient should seek dermatologist help, and if necessary, if they have an arthritis, a rheumatologist joint treatment approach will give them a long benefit, so that their life can see a happy family, happiness in their disease. Thank you.